Welcome to the second e-learning module in the Healthcare Toolkit. The Healthcare Toolkit is a program of Nextdoor Solutions to Domestic Violence in partnership with Mayview Community Clinic, with funding and support from Blue Shield Against Violence and Futures Without Violence. In this module, Rooming Alone, Special Considerations in Domestic Violence Screening, we'll cover the practice of rooming alone, policy considerations, including the use of translators, and how you can approach a patient. At the end of this module, you will have a clear understanding of what it means to room alone, and you will have the tools to implement this practice in your own organization. Depending on what kind of healthcare organization you're affiliated with, the term rooming alone can mean several things. But for the purpose of this training, rooming alone refers to the practice of placing a patient in an exam room or meeting room without their partner, significant other, or family for the purpose of screening for intimate partner violence. Let's talk about why rooming alone is important in the first place. First, meeting alone with a patient preserves their privacy and is HIPAA compliant. Patients may be reluctant to truthfully disclose abuse in front of family members, or may not want to discuss a history of abuse with a significant other in the room, even if there's no abuse in the current relationship. Rooming alone is important because sometimes family members, especially if there is a language barrier, may try to speak on behalf of a patient. You may recall from previous trainings that abusers often use intimidation to keep their victims compliant. Therefore, if an abuser is in the room, it is likely that the victim will be too afraid to disclose abuse. Lastly, rooming alone is important because if a patient does disclose abuse and the perpetrator is waiting elsewhere, you have put much-needed space between the victim and the perpetrator, which enhances the safety for the patient as well as the staff while you address next steps. Rooming alone may be a new practice for you, and if that's the case, you and your organization may want to take into account the following policy considerations. First, every organization should consider adopting a formal policy that states patients will meet privately with their provider at the beginning of each appointment, so intimate partner violence screenings can be conducted safely. Secondly, organizations should have policies in place that allow for the use of professional interpreters, so patients are not reliant on family members or their significant other to help them communicate with their healthcare provider. Organizations will want to develop a policy that outlines next steps for when a patient does disclose abuse, including what services will be offered on site, what services are referred out and where those patients will be referred, and organizations will want to be clear on their mandated reporting requirements and when providers may need to engage law enforcement or child and family services. Lastly, while not specifically related to the practice of rooming alone, while an organization is already reviewing their domestic violence policies, they'll want to make sure that they have a provision in their employment manual for employees who are experiencing domestic violence. So let's talk about how to approach a patient. We know it is not unusual for patients to bring a family member or a significant other with them to their appointment, and you'll want to explain to both the patient and their companion that you need to meet privately with the patient first and bring their companion in shortly. There are a few things your organization can do to ease this process. First, your organization can adopt a policy that requires providers initially meet alone with patients and then bring in support persons. Your organization can have a process in place allowing for access to interpreters or support staff to assist the patients in the absence of a family member or a significant other. And third, practicing rooming alone throughout the organization so patients and their support persons receive the same message from each department will create consistency and make it easier for providers to make that request. While healthcare providers should make every effort to meet with patients in private, they should never jeopardize their safety or the safety of their patients to do so. If you absolutely cannot meet with a patient alone to do the screening, then do not screen at that time. Instead, consider other options such as a follow-up appointment or a phone call. And if you do choose to speak to a patient over the phone, always make sure that the phone number is a safe number and that the patient is able to meet with you somewhere where they have privacy. Whenever dealing with issues of domestic violence, we must always bear in mind that situations can escalate, and we must always place safety first. Trust your intuition. If you have reason to believe that a situation or a person is unsafe, pay attention to that. Alert a coworker, a supervisor, or security personnel if needed. If you cannot meet safely with a patient, cancel the appointment or suggest rescheduling. If a situation escalates or you are fearful for your safety or are facing a life-threatening emergency, call law enforcement or dial 911. In this module, we have discussed the meaning and logistics of rooming alone for the purpose of screening for domestic violence, including policy and safety considerations. If you have any questions or feedback, please email us at dvhealth@nextdoor.org. On behalf of Nextdoor Solutions, thank you for viewing this presentation.